Hello my dear patient, tomorrow we'll have a surgery. I think you know your surgery time. Now, 8 hours before the surgery, you have to stop eating anything that is solid. What are those? Anything, breads, other things, even soups, coffee are assumed as solid things. So just stop them. What about water? Just water is allowed till 3 hours left the surgery. So 3 hours before the surgery, you can drink a glass of water and then nothing, water, no solids, it's not allowed. And 2 hours prior to surgery, you'll be in the hospital. You have to come early. Why? Because first we have to do a hospitalization and then the nurses will take care of you and they will prepare your papers and the consent forms will be just checked and then you will wait for your surgery time and then we'll call you in the right time to the operating theater and we'll meet each other there and surgery will start. See you on the operating theater for tomorrow. Bye-bye. Hello my dear patient. Now, as you see this video, your surgery is finished. Now, we have entered our healing period. You know that it's a long period and it will need some time to heal. So in the first 2 days, the thing about the swellings and the bruises will gradually increase, and on the second morning that you wake up, you will have maximum swellings and maximum bruises. What about the others? Pain? Generally you will not feel too many pain, but if you feel free to contact with us. You have painkillers and in hospital we'll give you painkillers. But know that in the first 2 days you will gradually increase in swellings and the bruises, so please never in panic. But if you think that anything is not going on well, please feel free to contact with us. What about the sprays and other things? We have some sprays. One is seawater. Seawater will be used every 2 hours for the first week. So it's very important to keep the nose open with the seawater. Another thing for the moisturizing effect is the nasal lamp drops. The nasal lamp drops or nasal lamp sprays, we can prescribe both. It does not differentiate. If you will have the drops just in the nostril tubes, just you will drop 2 drops to each side 3 times a day. If it's the spray, you will use 2 puffs to each side and then you will rest a head tilted back for a while for moisturizing effect to be spread all around the nose. That's the second one. What about the other one? It's the Iliadin. Iliadin is the opener of the nose and it's very important in a medical treatment for 5 days. You will use Iliadin for 5 days, 2 puffs in mornings and 2 puffs in the evenings, and then it will help us to keep the nose open. But even if you do everything, your nose can be blocked. If you feel it's very blocked, you can just contact with us and in the daytime you can come to the clinic and we shall try to aspirate the nose and you shall get rid of the extra mucus discharge, and so you will feel more comfortable with that. But please be sure that you need some time to heal and everything is not like a magic, so we need some time and patience to heal. That is very important as well also. What about the antibiotics and painkillers? You will have some antibiotics that you will use after the surgery. Antibiotics will be used twice a day and for 5 days. And the painkillers, you will use it if you feel pain. But although you use painkillers, if your pain continues, feel free to contact with us and we'll give you another alternatives too. And we'll meet each other on the first week of the surgery and then I will remove your spleen and I will tell what to do or what not to do in the post-op period. See you in the post-op period as well. Hello dear patient. Now we have removed your splint and we have taped the nose and now late healing period begin. It will be a long period. It will continue up to 6 months to 1 year. So we will wait from now on. When you see first your nose, you're shocked with it. You saw, okay, who is she or who is he? Because your brain has a memory and your brain saw someone else. We have to wait for it. Your brain will adapt it, your swellings will go down and everything will be settled in time. So what we will do after all? First of all, you have some tapes in nose. These tapes will stay for 1 week. You can do a full shower with these tapes, but after the shower, dry it with your hair and you will dry the tapes with the hair dryer. If they go off, we have new taping videos in our social media account, so you can learn how to tape the nose. After 1 week, you can take them off. In thick skins and the noses that has the risk of drooping, then I order the patients to tape the nose for 2 to 4 months according to the needs in nighttime, and it's also included in our social media accounts, and you can find how to tape the nose according to that. But if you have any problem, if you don't understand anything, feel free to contact with us for the taping or other issues. And the nostril retainer, the silicone tube. After I remove the silicone tube, I generally give an interval for 2 days, and then you will start to use the nostril retainer again, the silicone tubes, for 1 week as much as possible. Why it's needed? It's needed for the best nostril symmetry. If you use it as I said, you will have a better nostril symmetry in your healing after the healing period. And 2 months after the first 1 week, you will use as much as possible, and then 2 months you will use the nostril retainers when you sleep in nights. Okay, if you have a nostril asymmetry, you can use it up to 6 months. So we will be in contact, and you can contact us, and so we'll prolong the period, or we can shorten that period too. And what about the sprays that you will use after the surgery? The sprays, 1, seawater. Seawater will be used 3 times a day. If you can take the silicone tube off, and you can use it just inside the nostrils, and 2 puffs will be enough. 1 morning, 1 in daytime, and 1 before your sleep. And after using it, you will blow the nose to get rid of the clots and excess mucus inside. That's the thing. And then you will use a nasal lamp, the drops or the spray ones. If you're using sprays, 2 puffs, and if you're using drops, 2 drops to each nose. And then your nose will be moisturized, and you can go to sleep, or you can continue your work much better with a moisturized nose. If even you do everything, you still have clots, you can do sinus rinse kits, and then you can use them twice a day, 1 in the morning, 1 in the evening, for 1 month. In the first month, you will have some bloody clots coming from the inside the nose, and it's normal. But if you think that something is unusual, please feel free to contact with us. What about the sports? You can do all kind of simple sports starting from now on. But if you'll do weightlifting or some hardcore sports, please don't do it for 4 to 4 weeks, because I don't want an increased pressure in the first days after the surgery. What about eyeglasses, sunglasses? Don't wear any eyeglasses or sunglasses for 2 months. But if you have to, after 1 month, you can wear some light eyeglasses for short periods. Or if you have to wear heavier eyeglasses, you have to tape the nose, and just over the tape, you shall put the eyeglasses, because then it will put some marks on the nose, and that can lead to some dents in those areas, so nobody wants it. So take care of this too. After the period again, in the first 2 months, I don't want you to go to any very hot places like sauna, hammam or something like that, because they can lead to some bleeding problems. And we don't want any bleedings in the period. And please don't do something like the basketball playing or some boxing that can ball, or some punch can come to the nose, and I don't want big traumas in the first 2 months. If you go in these rules, but if you still think that something is missing and something you don't understand, you know our WhatsApp, you're always feel to contact with us, and I hope a very, very healthy healing period, and I think this new surgery will bring luck in your life. All the best. Bye-bye.